Hello everybody, here we are back again at Ask the Vet for another topic that was in our comments. This is about, in general, young bird disease syndrome. So I'll ask some questions, I'll read some questions that we got. One question was from Emmanuel Go. Young bird disease can be confusing because there are many symptoms similar. Is there a sure visual way to distinguish amongst adeno, paratyphoid and rota? That's a question. Another question was from Palomas Mensayeras. I don't know if I pronounce correctly. What is the best way to prevent adenovirus? And we had some similar questions. Now, young bird disease syndrome is something that has been for years a kind of a mystery. I know in a lot of articles there was always said, or in a lot of cases said, that adenovirus was the cause, but we have discovered this is actually not really true. In the 90s we found a lot of adenovirus in those cases, but never scientists were able to get people sick with those specific symptoms with infection with adenovirus. So it was a mystery. Sometimes they found adenovirus in that syndrome, sometimes they did not find it. In a lot of cases they did not find it. Sometimes they found circovirus, sometimes they found herpes, but not always. And of course, since Rota, we actually know now that it's probably the primary cause of young bird disease syndrome. Specifically, what does Rotavirus infection in pigeons cause? The first thing the young pigeons get is they stop eating and they get a watery crop. So there's water in the crop and they are not hungry anymore, so they start to lose weight because of that. A couple of hours after that they start vomiting. This is actually typical rotavirus infection, and now we are sure this is the primary cause, because when we infect pigeons, when scientists have infected pigeons with rotavirus, they got those symptoms. So when you see those three things, you are almost certain, or there's a big probability you are dealing with rota. Of course, there are secondary infections that can complicate the disease, like adeno, like E. coli bacteria. Of course, when there's paratyphoid in the pigeons, this can also complicate the situation. Herpes, circo, so all those other agents can also complicate the situations in those young birds. But we have seen that rota is really the thing you can try to work on. And so how do you prevent this disease? Try to prevent this by vaccinating, and that has really good results. If you vaccinate on time and you vaccinate a couple of times, so 2 times for example for young birds, certainly in colonies where there are problems, you really can battle the disease and the pigeons get immunity. It doesn't mean that all symptoms will disappear completely, but in a lot of cases they disappear really completely. And if you see a symptom like a little bit vomiting, then it is only 1 day, and the day after the pigeons are already healthy again, because they have a lot of antibodies because of the vaccination. So Rota vaccination is really an answer for this disease. Okay, thank you.